Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alameen. Now, actually, during this period of Ramadan, actually before Ramadan, I was taking about the infectiology, that is infection and disease, and it is a very, very long run because a lot of organisms has to be discussed. Those people who want to appear in RCB examinations, these lectures on video are fruitful for them. And those people who are intend to give Fcps part 1 examination, medicine allied or surgical allied or whatever, specialty allied, or those people who want to give the USMLE step 1 examination, basically the fundamentals, basics of the graduations, they are needed in this to clear this examination. In our part of the world, that is, we are doing FCPS fellowship examinations. The FCPS is actually in Pakistan and in Bangladesh, maintaining that college in Dhaka as such, and their quality of post-graduation is very high, and we are proud of it. That our graduation for this post-graduation at FCPS level are also recognized because the output is very good. The people who have done the FCPS examination and have got about 5 to 10 years experience, they are more confident, and they are doing well, very well, in comparison with the other people who have come from abroad. And this is not my statement, this is the statement given by the Pakistan Medical and Dental Council. They have studied the post-graduation levels of both of the foreign examination and for the in-examination, in-country examination. Because we know that we are actually focusing the fellowship examination into two parts, part 1 and part 2. As you know, the FCPS part 1 comprises the basics subjects. And those people who want to do the basic subject can do it. Anatomy, clinical anatomy, pathology, etc., where no interaction with the patients are needed. And you go for the another time at 8:30 and come after 2:30, and you are free. No responsibility behind afterwards. For the clinician are concerned, they are responsible persons. They are actually treating the people. Remember this. So the knowledge is needed, the background knowledge is needed in any way. I have already told you that what you have learned in the first professional examination and second professional examination and from the book. Please mark, if you have marked that book, please read the book first and then go for the BCQS examination. This is one way to do it. Second way is modular type of preparation, that one system is taken and full of the physiology, anatomy, physiology, biochemistry, and the applied sides, the pharmacology, etc. They are intermingled with this. So the thing is this: this is a short. Actually, I have already asked it on my friends. This thing that is there are questions which I have put previously, how to pick correct option from the stem. And there are two types of things which are needed here. One is the example of a scenario-based question. One scenario, a short scenario is given, and then the options are given. The thing is this, here it is written a 25-year-old low-grade fever with a vague abdominal pain, very specific statement, noted painless swelling in the right upper part of the medial thigh. The most probable cause of the swelling will be option A. It is cut down here, it should be here. A is that the fracture of the neck of the femur due to the sickle cell disease. When the age is 25-year-old, possibility is there. B, the tumor of the trochanter. In certain condition, it is silent tumor which is arising from the femur. Many types of the tumor of the bone can appear. Lipoma of the deep fascia, that is here is the fascia lata, which is called as the deep fascia of the thigh. Maybe it is possibility of a lipoma. And D, the tuberculosis of the lumbosacral spine. And E, the metastasis from the testes. Now here, this is a scenario. A young man with low-grade fever, although the duration is not written, with a vague abdominal pain, and he noted painless swelling in the right upper part of the medial thigh. These are the here hard data. So actually hard data have been given in this condition because a short scenario it is. All are hard data. No findings as far as the investigations are concerned have been given here. Now C, A, fracture of the neck of the femur due to the sickle cell disease. If it is sickle cell disease, the low-grade fever is not explained very clearly with the vague abdominal pain, abdominal crisis. The patient has got no vague type of abdominal pain, but in case of the sickle cell disease, the patient will come with the abdominal crisis. Very painful condition, ischemic condition. So chances of A is 10% only. B, the tumor of the trochanter of the femur. If it is a benign tumor of this, it is very rare, but it is not associated with the low-grade fever or the vague abdominal pain. If the tumor is of the primary tumor of the bone, fever may be possible, but the vague abdominal pain is not explained. If it is touching the what is called as the periosteum and lifting the periosteum, which is painful, definitely. But its chances is only 20%. Then comes the lipoma of the deep fascia. Lipoma is always, remember that it can be palpable, you cannot describe the borders. It is a swinging type of a feeling, and it is non-tender, not associated with a low-grade fever. Chance is very less than 5%. The metastasis from the testes, it occurs from the metastasis from the testes in this age. The testes always metastasize before appearance. Any swelling around it, it will be metastasized to the lungs or the bones. Because the lungs are the more favorite site. So chances is 30%. Great fever, the pain is a vague abdominal pain, not explained with this. Now left is only one. Diagnosis exclusion is D. Tuberculosis of the lumbosacral spine. Why it is? Because if the lumbosacral spine is called Pott's disease, if it is the lower part of the vertebra are involved, and there is a granuloma which is formed and oozing the exudate, it will trickle down from what is called a psoas fascia, because it is rising from that area, and it is inserted into the trochanter of the femur. So it's due to the gravitational force, it will be collected at the end point. That is the insertion of that muscle. So it is what is called as the collapsus. This is the collapsus resulting from the Pott's disease. D is the correct option. If you exclude the other thing, whether you can explain or not, that is another thing. If you can explain the pathogenesis, it is very good. If you are not able, then this is the correct answer. Now another example which is a direct question is this. In judicial hanging, the cause of the death within 30 seconds occur because of strangulation, paralysis of the diaphragm, acute respiratory distress syndrome, cerebral hemorrhage, and acute myocardial infarction. Let's start from the E first. EMI. Why acute myocardial infarction occurs? Because of the stress, because of underlying illness, because of the sudden embolism, because of the sudden embolism of what? Fat embolism or whatever embolism it is. It is very, its chances of correction is very low, 5%. Let's see the D1, cerebral hemorrhage. The judicial angle means that the person had got, they are encircled with the, forcefully with the rope, and there is a dashboard on which the patient was actually on the standing position, and the board was suddenly withdrawn, and the patient go into the down very, very quickly, very fast, at the speed of 120 km per hour. It is a lash type of injury which occurs on the posterior part of the neck. The posterior part of the neck, if it is, then the vessels which are under stress will be the vertebral arteries. It will block the vertebral arteries. It is possible. Hemorrhage is not possible. If it is, for example, the possibility of the infarction is there, the patient will not die in 90 seconds. He will take time. The chances are only 10 to 20%. Acute respiratory distress syndrome, all the stress is on the not anterior part of the neck, but on the posterior part of the neck. Acute respiratory distress syndrome occurs because of the many things, because of the trauma, because of the burns, because of many things. The underlying illness is not there with ARDS. The chances is less. Strangulation occurs when the person is doing the suicidal hanging. And suicidal hanging, the cause of the death is strangulation, because he will, jump out the stool is withdrawn and the pankhe se latak gaya. All stress is on the anterior part of the neck. The strangulation occurs not in the judicial hanging, but death occurs because of the strangulation in case of the suicidal hanging. The paralysis of the diaphragm occurs because of the very, very high speed injury at the neck, C3, C4, C5. The supply of the phrenic nerve damaged bilaterally, suddenly the diaphragm will not work and the patient die because of the absolute zero inspiration. A patient will die and it will hang, they will hang it inside that, what is it called, coma, and then after 3 to 5 minutes, 10 minutes, the doctor will come for the certification of the death. Patient was unconscious at the time when he jumped out into that coma or the underlying hole, whatever it is. So paralysis of the diaphragm is the correct answer. 90-second patient or will die. Gradually death occurs. And it is a painless death. You see it seems to be very, painful. It's not painful. Painful is suicidal hanging. वो हवा में लटकता रहेगा, तड़पता रहेगा, लटकता रहेगा, तड़पता रहेगा, स्ट्रॉन्गुलेशन हो रहा है वहाँ पे, जीरो ऑक्सीजनेशन हो जाएगी. इसमें इस तरह का मसला नहीं है. इसमें तो डायफ्राम ही आपने पैरालाइज कर दिया, बायलेटरल पैरालिसिस कर दिया, तो बचने का कोई इम्कान नहीं है. 90 सेकेंड में आहिस्ता आहिस्ता सप्लाई खत्म हो जाएगी, ऑक्सीजनेशन ही नहीं मिलेगी, ना हार्ट को मिलेगी, ना ब्रेन को मिलेगी, तो पेशेंट की डेथ हो जाएगी. And this is the pathogenesis of this. How I picked it. Now, these questions have come in 1993 or 94, which I was actually recalling. At that time, with a zero, negative marking was in practice. I took this one at once. I know that these are not the causes. This is called applied anatomy. Applied anatomy means that the anatomy you have learned, and then you have, whatever you have, you have gained from it. applied in your life. This is applied oral appeal. Snell's is the book in which a lot of examples have been given. So this is for you to learn from the Snell's, the better book. If you have learned from the Snell, that is good. Another book you have followed, okay, that's all right. If you underline, go through, and then do the BCQs, MCQs. So these are my suggestions for these the people who are appearing in the examination. This is session number 4, and I will take session 5, 6, etc., giving you certain other examples, so that you can understand how you prepare mentally that the questions are not what is the enough supply of the source measure. It is not like this. The question will be on another form, like this. So wish you good luck. Assalamu alaikum wa rahmatullahi wa barakatuh.